All right. Let's jump into a deep dive on vitamin D. We've got some excerpts from this article called The Role of Vitamin D in Boosting Immunity and Bone Strength. And honestly, some of this stuff is pretty wild.
Yeah, it really is amazing how much we keep learning about vitamin D. You know, we always think about it as being good for our bones, but it turns out it plays a huge role in the immune system as well. So,
Before we get too far, can you
Yeah.
give us like a quick refresher? What exactly is vitamin D?
absolutely. So, vitamin D is a fat-soluble vitamin, meaning that it gets stored in the body's fat. And one of the most fascinating things about vitamin D is that our bodies can actually produce it themselves when our skin is exposed to sunlight.
Oh, wow. That's why it's called the sunshine vitamin.
Exactly.
I knew that.
Yeah.
I never really thought about it like that. So that's why spending time outside feels so good. It's like we're getting a natural dose of
Yeah.
medicine. But what about sinus? People who live in places where they don't really see the sun that much.
Especially in the winter. Right. That's a great point. So, in those cases, it's important to make sure you're getting enough vitamin D through food sources and potentially supplements. Things like fatty fish, salmon, mackerel, sardines. Those are all really great sources. Also, egg yolks have a decent amount.
Fortified foods too, right? Like milk and cereal.
Exactly. Yep. So you can find a lot of those foods that have added vitamin D.
That sounds like a good diet.
Yeah.
And a bit of sunshine. Really important.
Right.
This article goes really in depth on the immune boosting effects of vitamin D. Can you tell us more about that?
Yeah. So vitamin D doesn't just like boost your immune system generally. It actually plays a very targeted role in how our immune systems respond to things. For example, it helps our immune cells produce these things called antimicrobial peptides, which are basically like little weapons
Right.
that can attack and destroy bacteria and viruses.
Whoa. Okay,
Yeah.
so it's not just making our immune systems like work harder, it's giving them more power.
Exactly.
Yeah.
That's pretty incredible. It's like equipping our immune army with better weapons and armor. And here's something else really interesting. Vitamin D also helps to regulate inflammation.
Oh. I've heard about that. But then really vitamin D was involved.
Yeah, so inflammation is a natural process. It helps our bodies heal. But when it becomes chronic, that's when it can be a problem.
Right. It can actually lead to other health problems.
Exactly. Heart disease, cancer, all sorts of things. So what vitamin D does is it helps to keep that chronic inflammation in check.
Oh, so it's like vitamin D is a peacemaker.
That's a great way to put it.
Okay. I'm starting to understand why everyone's talking about vitamin D these days.
Mm.
But we haven't even talked about bone strength yet.
Right. So everyone knows that calcium is important for strong bones. But what many people don't realize is that vitamin D is absolutely essential for our bodies to absorb that calcium.
Right.
Without enough vitamin D, you could be eating all the calcium-rich foods in the world, and it wouldn't do you much good.
So vitamin D is like the key. That unlocks the door for calcium to get into the bones.
Exactly.
That makes a lot of sense.
And when we don't have enough vitamin D, our bones can become weak and brittle, which can lead to conditions like osteomalacia in adults and rickets in children. And it's especially important as we age, because bone loss is a natural part of getting older.
All of this is making me wonder, if I'm getting enough vitamin D, are there like telltale signs that someone might be deficient?
There are a few things to look out for, but it's important to remember that these can also be symptoms of other conditions. So it's not a guarantee, but things like feeling tired all the time, getting sick frequently, muscle aches, bone pain, those could all be signs.
But those are pretty common things. How would someone know if it's actually a vitamin D deficiency?
Well, that's where it's helpful to understand your risk factors. Things like living in a place with limited sunlight, having darker skin, being older, certain medical conditions, or even just spending a lot of time indoors. Those can all increase your risk if you're concerned. The best thing to do is to talk to your doctor and get your vitamin D levels checked.
Yeah. I think that's always good advice. Better safe than sorry. Especially with something as important as vitamin D. Now, I know we talked about sunlight and diet, but I was curious about vitamin D supplements. I see D2 and D3. Is there a difference?
You're right. There are two main types of vitamin D supplements, D2, which is ergocalciferol, and D3, which is ergocalciferol. Now, D3 is the form our bodies produce naturally from sunlight, and studies have shown that it's actually more effective at raising and maintaining vitamin D levels in the blood compared to D2.
D3 is the one to go for.
In most cases,
Yeah.
yes. But it's always a good idea to consult with your doctor or a registered dietitian to determine the right type and dosage for you.
Right. That makes sense. This has been incredibly informative. I feel like I've learned a lot already,
Yeah,
and I'm sure our listeners are feeling the same way. But before we dive into the research, I think it's time for a quick recap.
absolutely.
Okay, so we started by talking about what vitamin D is, a fat-soluble vitamin that our bodies can make from sunlight. We also touched on some other ways to get it, through our diet and supplements. And then we really got into how vitamin D supports our immune systems, not just boosting it generally, but by actually like regulating its response and even giving our immune cells better weapons.
Yep. And we talked about the importance of vitamin D for bone health, especially its role in helping us absorb calcium
Yeah.
and the potential consequences of not getting enough.
And the signs of deficiency, and some risk factors to be aware of.
Wow.
This is just the tip of the iceberg, so stay tuned for part 2, where we'll be exploring the latest research on vitamin D and its impact on immunity and bone health. It's going to be fascinating.
Definitely. Welcome back to our deep dive on vitamin D.
All right, let's jump back in. So last time you mentioned there's actually a lot of research supporting all these benefits of vitamin D. I'm really curious to hear about that, especially when it comes to immunity. What kind of evidence are we talking about?
Oh, no, it's not just anecdotal evidence anymore. There have been a lot of really interesting studies lately that show a strong connection between vitamin D levels and how likely we are to get infections, particularly respiratory infections. Oh, wow. So like actual large-scale studies,
Yeah.
not just small ones.
Yeah, exactly. One that really stood out to me was published in the British Medical Journal. It looked at data from over 11,000 people, and it found that those who took vitamin D supplements regularly were significantly less likely to get colds or the flu.
Wow. 11,000 people, that's a pretty big study.
Yeah.
But do we know how vitamin D is actually doing that? Like protecting us from those infections?
Right. So remember how we were talking about vitamin D helping our immune cells produce those antimicrobial peptides, those little weapons?
Mm-hmm.
Well, it seems like vitamin D is crucial for making sure our bodies have enough of those ready to go to fight off
Oh,
infections.
so it's not just boosting the immune system generally. It's actually making sure it has the right tools to do its job.
Exactly.
That's pretty cool. Now, I've also heard that vitamin D might even be helpful in preventing more serious infections, like pneumonia. Is there any truth to that? Yeah, there is actually. A lot of studies have shown that people with higher vitamin D levels tend to have a lower risk of developing pneumonia. And some studies even show that taking vitamin D supplements could actually improve outcomes for people who do get sick.
Wow. That's really interesting. So it sounds like vitamin D could be a really powerful tool in helping us fight off those respiratory bugs, especially during cold and flu season.
Definitely.
It's not all about fighting off outside invaders, right? You mentioned something about autoimmune diseases earlier. What's the connection there?
Oh, right. Yeah. So autoimmune diseases happen when our immune system mistakenly attacks our own body's tissues. And while we're still learning about all the details, there's more and more evidence that vitamin D plays a role in regulating this process.
So it's kind of like vitamin D helps to make sure our immune system doesn't go overboard.
Yeah, exactly. It helps keep things in balance. And research suggests that vitamin D might even be helpful in managing conditions like multiple sclerosis
Right.
and rheumatoid arthritis, which are both autoimmune diseases.
Wow. This is all really fascinating stuff. I'm sure our listeners are loving this. Now, we've talked a lot about immunity, but what about the research on vitamin D and bone health? What are some of the big takeaways there?
Okay, so the connection between vitamin D and bone health is super well established. Remember how we talked about vitamin D being essential for calcium absorption?
Yep.
Well, without enough vitamin D, our bodies can't actually use the calcium we get from our diet, which can lead to weaker bones and a higher risk of fractures.
Right. I remember seeing those milk commercials
Yeah.
back in the day
Yeah.
with the "Got Milk" slogan.
Yeah.
They always talked about how calcium builds strong bones and vitamin D helps you absorb it.
Exactly.
Seems like they were onto something.
They were. There's so much research to support that. Tons of studies have shown that having enough vitamin D is linked to better bone density, which is basically a measure of how strong your bones are.
And stronger bones mean
Yeah.
less risk of breaking something. Right.
Exactly.
That's good to know. Especially as we get older.
For sure.
Are there any studies on bone health that really stand out to you?
Yeah. There's one that comes to mind. It was published in The Lancet, and it followed over 36,000 postmenopausal women for 7 years.
Wow.
And they found that the women who took vitamin D supplements had a significantly lower risk of hip fractures compared to those who didn't.
That's huge. Hip fractures can be so debilitating,
Yeah.
especially for older adults.
Absolutely.
So it sounds like making sure we have enough vitamin D could really help prevent those kinds of injuries.
Absolutely. And it's not just about preventing the worst case scenario. Vitamin D also helps to slow down the natural bone loss that happens as we age.
Mhm.
So it helps us maintain our mobility and independence.
That's amazing. Well, this has been so informative. I really appreciate you sharing your expertise with us. It's incredible how one nutrient can have such a big impact on so many different parts of our health.
It really is. And you know what's even cooler? We're still learning new things about vitamin D all the time. There's tons of research going on right now, looking at its potential role in other areas too, like heart health and even cognitive
So
function.
vitamin D is like a multitasking superstar.
Yeah.
But before we get too carried away, I think we need to bring things back down to earth
Yeah.
and talk about what people can actually DO to make sure they're getting enough of this vital nutrient. So stay tuned for the final part of our deep dive, where we'll explore some practical ways to optimize your vitamin D levels,
Right.
both naturally and through supplementation. Ooh, yay. The last part of our deep dive into vitamin D. We've talked about what it is, how it works, and all this amazing research on its benefits for immunity and bone health.
You know, it's one thing to understand the science, but it's another thing entirely to put it into practice. So let's talk about some practical ways that you can actually optimize your vitamin D levels.
Yeah. That's what I was thinking. I bet a lot of our listeners are wondering right now, okay, all of this sounds great, but what can I actually do to make sure I'm getting enough?
Yeah.
So what completed? Let's break it down. We've talked about sunlight being a natural source. Can you tell us a bit more about that?
Sure. So when our skin is exposed to sunlight, specifically the UVB rays, it actually starts this process that converts a type of cholesterol in our skin into vitamin D.
So we basically have like a built-in vitamin D factory in our skin.
Pretty much.
But I know there are things that can affect how much vitamin D we make from sunlight.
Oh, yeah, definitely. Things like your skin tone, the time of day, where you live.
Can you explain how those things make a difference?
Yeah, so people with darker skin have more melanin, which acts as a natural sunscreen, so they need more sun exposure to make the same amount of vitamin D as someone with lighter skin.
Okay.
And then there's the angle of the sun. The UVB rays are strongest around midday, so that's generally the best time to get some sun.
But of course, we got to be careful about sunburns too.
Oh, absolutely. Always practice sun safety.
So it's all about finding that balance. Enough sun, but not too much. But what about those of us who live in places where there's not much sun? Like I'm thinking, during the winter months.
Right. In those cases, it's important to make sure you're getting vitamin D from other sources, like your diet and potentially supplements.
So
Yeah.
you mentioned fatty fish earlier.
Yeah.
Like salmon and mackerel.
Exactly. Those are great sources. And egg yolks are good too. And then there are fortified foods, like milk and some cereals.
Okay, so eating a balanced diet can definitely help. But what if someone doesn't like fish or they have a dairy allergy?
Well, that's where supplements come in. They're a really easy and reliable way to make sure you're getting enough vitamin D, no matter what your diet is like.
That makes sense. But there's so many different supplements out there. How do you even choose one?
Well, remember how we talked about the two main types of vitamin D supplements, D2 and D3?
Yep.
D3 is generally the better option.
Yeah.
Because it's the form our bodies produce naturally.
Okay, so I should look for a supplement that specifically says vitamin D3.
Exactly. And choose a reputable brand that uses high-quality ingredients.
Got it. Now,
Yeah.
I know we can't give specific medical advice, but are there general guidelines for how much vitamin D people should be aiming for?
The general recommendation for adults is about 600 to 800 IU per day, which stands for international units.
Okay.
But keep in mind, everyone's needs are different. It can depend on things like your age, your health conditions, your lifestyle.
Right. So it's always a good idea to talk to your doctor about what's right for you.
Definitely.
Well, this has been such a fascinating deep dive into vitamin D. I've learned so much about how important it is for our immune systems and our bone health.
Me too.
And we've talked about some really practical ways to make sure we're getting enough.
It's amazing to think that something as simple as vitamin D can make such a big difference in our overall health and well-being.
And you know, getting enough vitamin D, it's not just a one-time thing. It's something we need to think about throughout our lives, just like eating healthy and
Yeah.
exercising regularly.
Couldn't agree more.
So by following some of the tips we've discussed, like getting some sunshine, eating a variety of healthy foods, and maybe even taking a supplement, you can really take control of your health.
Absolutely.
Well, that's all the time we have for today. Thank you so much for joining us for this deep dive into the world of vitamin D. We hope you enjoyed it and learned some valuable information. that you can use to improve your own health. And remember, this is just the beginning of your journey. So keep learning, keep exploring, and keep thriving.